Hey everyone, it's Tabria back with another episode of Milk Trunk. Our guest today is pretty much every new patient's dream interview, a medical professional. Dr. Mona Amin is a board-certified pediatrician working in private practice and a lactation consultant. She's an expert on child health, development, and parenting. She's the host of the top-rated parenting podcast, Peds Doc Talk, and she's a mom of two on a mission to share balanced, well-researched parenting advice to ease parents' worries and help them find more joy in parenthood. Dr. Mona is also a member of the Parents.com Expert Review Board, and she founded the New Mom Survival Guide, the first online digital e-course created by a pediatrician and mom that guides parents and their baby through their first year of life. Welcome to Milk Trunk, Dr. Mona. It is such an honor to meet you. Your content is like a lifeline for new parents like me because you create a safe, trusted space for parents to access credible, relatable, and destigmatizing advice from a doctor who is, like you say, also a mom trying her best, which is so reassuring. So welcome to Milk Trunk, Dr. Mona. I'm super excited to talk with you about everything, especially from like a personal and professional standpoint. First, I want to know if you could give us like a look into your background and what led you to becoming a pediatrician.
Yeah, well, thank you so much for having me. I am so excited about your show. The work that you are all doing is fantastic. And yeah, I am a board certified pediatrician as well as an IBCLC. I became a pediatrician in 2012 when I graduated medical school and residency in 2015. And then I got my IBCLC license in 2021. And I have always loved working with children. I know most pediatricians will say that. And a lot of the reason I love being a pediatrician is that when I looked at health going through medical school, I looked at where is it that I can go that I can make the most impact. And that's what I called going downstream, meaning going to those early years, how we approach health, how we approach what we eat, how we approach sleep, how we approach our emotions, all of those things lay a foundation for a healthy adult. So I have a husband who's an ER doc, and he'll come to me and tell me, people came in for X, Y, and Z. And I love being able to have that impact from an early age for parents to make their kids live the healthiest life possible. And that's both physically and mentally. And through my experience of being a pediatrician, I've also learned how important parental mental health and parental health is. And I would dare say that's even more important than all the parenting education I give is how are we able to support these parents that have the incredibly hard job of raising these children to be hopefully healthy and kind humans. So that is kind of my story. And I love being a pediatrician. I love being an IBCLC for that reason, to give that non-judgmental, really supportive and uplifting, but also real guidance and advice for parents all around the world.
Yeah, I love everything that you said, especially being an IBCLC and a pediatrician. That just kind of blows my mind. I couldn't imagine somebody doing both. I know I'm jumping around here, but what made you want to do that?
So I always knew that I wanted to get a higher level license in lactation education. So to be perfectly frank, pediatricians, we do not get as much education as an IBCLC, which is why there's a separate license, right? So I always thought that, I wish every pediatrician had a requirement that they needed to get IBCLC licensing or education. That wasn't a reality. So I told myself that at some point I'm going to want to do it. Time passed, you get busy. And then I got pregnant with my first child. And then I had a really tough postpartum experience with him. And at that point, my dream was to breastfeed him. But because of a very severe traumatic birth, I couldn't breastfeed. My body just wasn't producing milk at all. And I put so much pressure on myself to breastfeed, put so much pressure to pump, when literally my body was like, Mona, you are really sick. We don't want you to produce breast milk. You need to heal and survive. And I felt so pressured by some of the lactation consultants who didn't really read the room when I was super sick, and they'd come in and they would say, hey, did you pump? And I said, no, I didn't pump because I had to get an NG tube placed down my nose because I'm sick. So there was a lot of lack of compassion and understanding from the people that I met postpartum. That's not to say that all lactation consultants are like that. And so my goal was that I wanted to get more education into IBCLC education to better help not only people who want to solely breastfeed, but for those people like me that maybe can't breastfeed, help them troubleshoot, but also give them solutions if breastfeeding isn't for them. Hey,
Yeah.
do you want to introduce formula? Do you want to pump? And so I went on this journey to get the licensing, learn way more about the physiology and how to help. And then also through my own just awareness and desire, I started getting really educated on pumping education because that's what I ended up doing for my second daughter. And I found such joy in exclusive pumping. I found joy. I found I was able to give my daughter breast milk, which I wasn't able to do for my son, but I
Hmm.
also had the freedom to have others help in feeding her, And so I really wanted to be that voice. And in the IBCLC world, there's so much polarization, right? Like, well, if you support formula or if you support pumping, that's not what our goal is. It's only at the breast. And I say, I get that. I do. I wanted the same thing. I love that. But I also know that many birthing people do not want that or
Hmm.
they can't. And so where can we get that educated person that sees the whole family? As a pediatrician and an IBCLC, I think I can do that, right? I see everything come together. How is the mom's maternal health? How is the other caregiver's maternal health, mental health? How is everything going? What is it that you want? Is what I always talk to my families about whenever I give that newborn feeding guidance. And so you're right, it is like I hit the jackpot with having both of those degrees. And I love being able to, continue to practice in these fields and really get better and learn even more about pumping, nursing, all of these things. And also just letting it go for parents sometimes and saying, is this what you want? Which I think
Yeah.
a lot of parents do not hear because of the narrative that's been told to them when it comes to newborn feeding.
Yeah. I find it so interesting that, you struggled a lot with your first and breastfeeding. And I met with a few IBCLCs and we landed on one that we eventually liked. But I think their intentions are in the right place, but a lot of them will kind of force that narrative that breast is best on you. And yes, I am seeking you out because I want to see what works best and if we can make this work for our family. But a lot of them are just so focused on the breastfeeding aspect that they're not looking at it from a holistic aspect of what is working best for you and your body and your baby. So that really means a lot. And I mean, I love my pediatrician. She's great, but she didn't know anything about,
Yeah.
breastfeeding. And
I
she
mean,
knows, yeah.
all of us, and I'm happy to admit that because I think it's important that we're transparent about that because we can't be experts at everything. And even
Right.
to be quite frank, I'm an IBCLC, and I will say that I could be better at guidance on nursing, meaning taking the baby to the breast, right?
Hmm.
I've helped some mothers, but I don't have as much experience because I don't get the time in my practice. But what I do have is pumping education knowledge. What I do have
Hmm.
is combo feeding. So I say that because I think it's important that we have experts in this IBCLC world that, some of them are going to be like, I'm going to get you to nurse. And that's all you're going to do because that's what the mom wants to do. But then
Hmm.
you may have someone like me that's like, hey, do you want this combo? Because I can help you figure out the combo. Because at the end of the day, it comes at finding that person that's the right fit. Like you said,
Yeah.
going through different interviews, maybe to find that right person that gets your feeding goals. And sometimes those goals can change, as you and I both know when you have kids
Totally.
or go, have another kid as well.
And you mentioned that you had a traumatic birth experience for your first. Do you mind going into that if you're comfortable?
Yeah, this is a story in itself. This could be like a book one day, and I hope to one day write a book about it because I think I can teach a lot of people about life through this experience. And I
Mhm.
had a very healthy pregnancy with my son until about the end where I started getting high blood pressure. So,
Mhm.
if you're not familiar, if you have high blood pressure, they're monitoring you for preeclampsia, which means, checking your urine, making sure that the baby is safe. And so I had to go to the doctor every 4 days to make sure that my blood pressure was okay, home readings. And then we made the decision to induce. And at that point, I had a vision of nursing my baby. I had a vision of, having this non-medicated birth, vaginal
Mhm.
delivery. I had this vision. And I told myself that, okay, if it doesn't happen, fine. But that's what I had hoped. So I had planned accordingly. At that point, I wasn't a lactation consultant. So I had two various lactation consultants lined up. I had all these things set. And then we scheduled the induction 2 days before my water broke. So we didn't need to do the scheduled induction.
Hmm.
And then went into the hospital, happy smiles. And then I wasn't progressing in terms of dilation. And then my OB at the time decided with me that, hey, I think you need to get a C-section because your
Mm.
water broke for about 23 hours. We're approaching a risk now of infection. And I know that as a pediatrician that a delay, delaying it could cause harm. So we made the decision to go into the OR. And when we got in there, normal prep, not a scary situation. And when she opened up, they couldn't get my son out of my uterus. And what had happened was because he had transcended all the way down and he was already head down into the canal ready to come out, but I just wasn't dilated. And I was contracting around him. They couldn't pull him out because he was stuck in my uterus, which is
Oh
probably one of
my
the most
gosh.
scary things for any OB to experience. So now they're trying to figure out how to get this baby out of me when my entire uterus is collapsing around him and time is of the essence. So panic ensues. My husband passes out because he sees all this chaos, and he's an ER doc, by the way, like I mentioned.
Yeah.
I'm laying there on the C-section table, not knowing what the heck is going on, but just hearing panic and them calling for another OB overhead because they need two people to help get the baby out, which was my son. They finally were able, I don't even know how much time passed. They were finally able to get him out. And I didn't see him, but my husband did. And he was blue, limp. If you're familiar with Apgar of 1, so he was barely alive. They had to resuscitate him. I didn't see him at all at that moment. And to this day, I strongly believe that I wasn't supposed to see him because I think I would be more traumatized and that
Mm-hmm.
that was almost a protective way of me not to see him like that in blue because my husband did. And it had really impacted him. And
Mm-hmm.
all I remember was making eyes with the nurse and seeing the nurse's how scared she was in her eyes because this baby was blue and limp. And I just locked eyes with her and then I just started to cry on the table. I just started to cry. They were able to resuscitate him, take him to the NICU. And that was the last thing I remembered because they had to give me so much medication to relax my uterus and also calm us
Mm-hmm.
down because it was chaos. And
Yeah.
the next thing I know, I wake up in the recovery room. My husband comes and he went to go see our son who's now breathing on room air, and was happy and feeding. And they had to obviously give him formula because I wasn't able to take him to breast. And I kept asking my husband, is he okay? Is he okay? And he's like, Mona, he's wonderful. I'm like, but he didn't have oxygen. Is he okay? Like, that can lead, like, is he okay neurologically? And my
Mm-hmm.
husband's like, yeah, Mona, he's fine. And I was like, okay. And then the next day in the NICU, I'm holding him and he starts having a seizure in my arms. And I'm like watching it. And I'm a pediatrician. And I'm like, this isn't normal. And I'm like, maybe it's in my head. Maybe it's just normal twitches that newborns can do. But this was one sided and it fell off. I told the nurses, they said, this can happen postpartum after a stressful experience. I'm like, you're right, but it's weird. Something about it I don't like. And then he did it again. And we got a whole neurological evaluation to find out that he had a stroke and a seizure from the delivery, from all the traumatic experience trying to get him out. So he had his own recovery. I was making my way to the NICU from my own postpartum unit, dealing with that own grief. And then a few days later, I started getting really sick and I couldn't keep food down. And my belly looked like I was 9 months pregnant again. And I felt winded and I couldn't visit him anymore. And I kept telling the team, like, hey, I don't feel good. They kept saying it was anxiety, that something's wrong and it's because of your son and you're really worried. I'm like, no, I'm really sick. And then I ended up having peritonitis, which is basically an inflammation and infection of the abdomen. And it was because of infected fluid that was collecting in my uterus and in the surrounding pelvic organs. And so I ended up in the ICU myself. That's when I talked about, I was still waking up to pump. I was still setting that timer when I had an NG tube in and all the
Oh my
wires and doing all of it.
goodness.
And that there was one day where I was like, I'm done. I can't do this anymore. I need to sleep. I need to sleep. And so I stopped putting the alarm on and I slept for 10 hours overnight. The grief of having a child in the NICU while you're still recovering. Thankfully, I recovered. We healed, went to therapy, did well, pandemic hit, and then we wanted to get pregnant again. And we did IVF, got pregnant with our second child through IVF, got one embryo, and she was our miracle embryo. Healthy pregnancy until I got gestational diabetes, a redemptive C-section where I had a new OB, did amazing experience in that OR. But then I ended up getting the same exact complication
Oh
that I
my
had with my
goodness.
son, which meant peritonitis, infection, and then I also needed IV antibiotics. So we later found out that I have a very rare case, which only has been reported about 210 times in the world, which is called vernix caseosa peritonitis, which means my body created an inflammatory, infectious response to the amniotic fluid and the vernix that is on the baby that gets dipped
Mm-hmm.
into the abdominal cavity when a woman has C-sections. And there's no way
Mm.
to know it until you have it happen and have it happen twice. So I'm a rarity. I'm a textbook case. And honestly, those two experiences, I thought that the second delivery would be redemptive and that postpartum experience, but I will never have the experience of taking a baby home day 2 or 3 of life. I will never have the experience of not being on IV antibiotics postpartum. I'll never have the experience of knowing what a normal postpartum belly is supposed to look like,
Mm-hmm.
2 to 3 weeks postpartum. And that was a huge form of grief for me. And it still crosses my mind from time to time. But you add that on to all the things that we have to do as moms already. And I that's why my platform is about healing and recovery and really
Mm-hmm.
being understanding of people's struggles, because I went through it. I struggled really hard. My community knows how tough it was for 4.5 years to birth these 2 children into the world, which are now my pride and joy, and they're phenomenal children. But God, they tried to kill me twice. I mean, I'm not
Oh
even.
my
If I
goodness.
write a book, I was probably going to write that. My kids that they tried to kill me, because I can't have another child because
Mm.
the risk is high that I could probably die if I have a third child, because I can't have C-sections, and it's wild, and that is the story. I know I could go more detail, but yeah, that is it. And it was obviously a very hard time, and we're in this process now of healing, and I'm grateful that I'm done having babies, although I love children and I would love a whole kitty litter of them, but my
Mm-hmm.
body says no. My mind says no. And I get these beautiful children now that I get to raise, and even more amazing is I have this online platform that I get to help parents raise their children. So even when I get a little sad that we can't have a third, I think, well, that's okay. I have 300,000 followers that can learn with me, and I can help their
Yeah.
baby and teach them and help them grow. So it is a beautiful but sad story, and
Yes.
with, I
Ugh.
think, a happy ending.
I mean, my mouth was literally agape as you were telling me everything. I cannot believe you went through all of that. That's insane. I mean, but you're a rarity and miracles happen and you're able to have 2 beautiful children and you're still here too. Like, that's incredible. But I mean, it's amazing that you share your story because I've never heard of anything like that. That's crazy. Gosh,
Yeah, I mean,
man.
we didn't either. We're both in the medical field, and even our OB the
Yeah.
second time was like, "There's no way that this is happening again." She's like, "This can't be happening." Like, they were shocked because it's rare, and I was the one who pulled up because I was literally sitting in the hospital bed. I'm like, "This is weird. Why am I getting the same exact story, the same exact way?
Yeah.
Like, literally 3 days postpartum." Spiking fevers, heart rate increasing, distended abdomen. I'm like, there's no way that this would happen twice. And so then I did some research. I looked up articles and I found this and I showed it to my OB, and she's like, wow. She's like, this is what you have. And I was like, yeah, this is wild stuff. And so, even in healthcare, my husband and I are both physicians, even
Mhm.
doctors, we're always learning about the human body, and that can be scary. And it's a really wild story because it is. And I know a lot of your listeners will probably say that they've dealt with things that they never even heard of, or maybe their doctor was like shocked about,
Yeah.
because that's the reality of the human body. And although it's scary, I know I was in the right place that second time. They listened to us. Having a good care team is vital because they
Mhm.
did not dismiss me in the slightest. They said, "What do you want us to do?" I'm like, "Image, image, image. Get me my blood work. Get me antibiotics." Like, I'm like, "There's something going on." And then I was healing on my road to recovery. So it's so important to understand that although we are always learning as healthcare professionals, having a good team that is willing to look at that big picture and say, "You know what, I
Mhm.
believe you. Let's figure this out," is
Yeah.
fundamental.
Yeah. And I mean, obviously, you're a pediatrician, so your perspective was different, but I can't imagine going through something like that and not having like any medical knowledge whatsoever because
Exactly.
you're able to advocate for yourself. I would be scared out of my mind if I went through that. I can't imagine. And I had a very normal delivery. It was fine. But everything that I went through, like, even postpartum, it's still a lot, whether if
Yeah.
you have a perfect delivery, you're still going through so many hormonal changes. And I I can't imagine going through that. And I'm like tearing up right now.
Oh.
But I know you're a big advocate for, just mental health, especially in the postpartum era. And as it relates to fathers as well, like paternal, mental health. And I wasn't worried about my boyfriend. I was just focused on myself.
Yeah.
I feel bad saying this, but I didn't care about his mental health at
Well,
that
most people
time.
don't.
Yeah,
Most people think about if
yeah,
it's heterosexual, they're thinking about the birthing mom and the baby. And
exactly,
yeah, it's
exactly.
the male in a heterosexual couple is usually left behind. I mean, it's
Yeah.
true.
But they can definitely have postpartum depression and anxiety, especially. I think that's what he experienced the most. And I can't imagine what your husband went through. Could you speak more about that? Anything, please.
Yeah, you're right on, and we had a a bad hand of cards handed to us, and I'm going to be very transparent, and I speak about that, right? We went from having a traumatic birth to the pandemic, right?
Mhm.
Because 3 months
Yeah.
after my son was born, the pandemic started, and we're both healthcare workers. So my ER doctor husband, who was frontline in an uncertain world of what the heck that virus was, right? When COVID started, was terrifying. So we had stacked grief that we weren't able to actually process. So you think about if you injure your arm, you put it in a cast, right? When you are experience trauma, your brain doesn't even have time to heal because you're just getting more trauma and more
Mhm.
experiences added. You don't even have time to just heal what needs to be healed. So we just got compounded trauma. So we went from birth trauma to a pandemic to doing IVF, which is also a form of grief. I mean, the amount of
Mm.
time and energy and anxiety and depression I went through, which I later realized was anxiety and depression through that process. And then subsequently having it happen again with our second sibling, right? Second
Mhm.
child. My husband, it was probably when I was pregnant, when he realized and reached his lowest low with depression. And he always had some degree of anxiety. I always did as well. But he reached it when I remember it was January of 2023 when the year my daughter was born. It was June she was born. And he was
Mhm.
sitting on the ground crying in our house. And I'm very open. We talk about the story, so I'm open sharing it. And he was crying, and I took out my phone and I took a video of him crying on the floor.
Mhm.
And the reason I took out my phone is that I know my husband so well that he reached the point where he knew he needed help and that he was going to get help and that we were going to get him back to a point where he felt like himself again. And that this video would just be a reminder of how far he came. And at that
Mm.
point, he started going to therapy. At that point, he has been now seeing a therapist every week consistently, going through his own trauma therapy, being an ER physician and all the things that he sees. When you think about ER, think about all the trauma that you see.
Yeah.
And then the trauma that your own wife went through, seeing your blue son in the operating room, being helpless. I mean, even if you didn't go through the medical complications that I did, any partner is watching their partner struggle, right? So whether it's your breastfeeding or whether you are healing from a vaginal delivery or C-section without complication, they can feel actually very helpless because they can't do anything. They're maybe working, maybe they don't have leave, maybe they're dealing with the anxiety of having to provide for their family,
Mhm.
sleep deprivation, right? It impacts
Yeah.
us all. We're not the only ones that deal with sleep. Our partners do too. And then now
Mhm.
they have to go to work. So they're handling a stressful job. Babies are crying. The sound of a baby cry overwhelms anyone. They're also dealing with their new identity. What does it mean to be a father? What does it mean now where I don't have the usual freedoms that I used to? And I don't know what the heck I'm doing. And that exists whether you are a mom, a dad, an adoptive
Mhm.
parent, if you had a baby by gestational carrier, that reality exists for everyone because a newborn, yes, of course, we have hormones if we birthed a child, and that does add another layer. But I can say that I've worked with so many different families that just the having a newborn aspect, right?
Yeah.
The immense change and responsibility for this living life and having to figure out this baby and getting all these mixed messages from all these experts, including myself, maybe that's like, do this and don't do that. You're going to harm your baby. You can really feel overwhelmed. And that includes males too. And so I'm very open about that. Maternal and paternal mental health to me is the most important thing because in my opinion, it's the foundation for child development. If I have a parent who's not there for their child mentally, meaning they're depressed,
Mm-hmm.
anxious, not getting the help they need, they're not going to be able to connect with their babies in their true self. They're going to be blocked, right? If
Mm-hmm.
they're depressed and gazing out the window or not wanting to connect with their child, we're losing that social and emotional bond, which is why everything I go to is how are you feeling? Is this impacting your mental health? What can we do to help your mental health? And so I
Mm-hmm.
will never fall into that narrative of sleep deprivation is just part of the game. Of course, it's
Yeah.
part of the game,
Yeah.
but let me teach you some strategies on how we can lengthen sleep stretches. How are you doing with feeding? Like, we tend to say that we have to be these martyrs and that you're not going to sleep for 2 years. You're not going
Mm-hmm.
to do this. Just, you're going to have to say bye to this. I call BS because we say that, but there are solutions. We can stretch sleep. We can make sure that the baby is getting developmentally appropriate needs, but also what can the parent do to get those stretches? What can the parent do if feeding isn't going well and they're tapped out and nursing? I don't want a mom who's nursing and hates their child and resents their child. I
Mm-hmm.
rather have a mom that says this is not for us and formula feeds. And that is what is getting lost in the messaging. I have had so many mothers who 3 years after they had a child tell me, I was depressed and I didn't do anything about it. I
Mm.
lost 3 years of my child's life living in this fog, doing things that I thought I had to do and not feeling the space to do something different. And I say, yeah, I'm here to tell you there's not one solution here. We can find options. We can utilize your resources and what you want to find a solution that works for you because at the end of the day, it's a family. It's not just
Yeah.
about the baby. It's about dad, mom, any caregiver, and about that baby as a whole family unit. And that is how families thrive.
Yeah. Oh, goodness. I I wish everybody could have you as a pediatrician. I love everything. I just love everything that you're saying because I know Bobby is really big on the Paid Family Leave
Yeah,
Act. And, the stat that always just like rings in the back of my mind is 25% of people who just gave birth have to go to work 2 weeks after. And
awful. Yeah.
I know it's absolutely insane. And it's like, mental health is so important when it comes to entering this new stage of your life. And people can't even just take time to address like how they're feeling and their emotional awareness and things because they have to just get back in the grind. And it's so unfortunate. I mean, I know how you feel about this obviously, but yeah, it's so sad.
It is. I mean, it's absolutely sad and it's actually harmful when we think about it, right?
Yeah.
I mean, I think the fact that there isn't paid leave and that there isn't just leave in general, like let alone paid leave,
Mhm.
but just actual freedom to have true leave longer than 12 weeks. I mean,
Mhm.
I think about myself that I couldn't even stand up straight, like literally stand up straight until I was 9 weeks postpartum with both my babies.
Ugh, wow.
And I'm a very physically active person at baseline. So this
Yeah.
isn't so 9 weeks postpartum. I couldn't even stand up straight because of all the surgeries and complications I had with both the children, right?
Mhm.
And so you think about that. I know I'm just one story, but I know many moms who physically cannot even get up and are still using like maybe one of those things to help pick up things off the floor or are still dealing with vaginal tears. I mean,
Totally.
it's
Mhm.
it's longer than 6 weeks of recovery. It takes about a year to 2 years to fully quote unquote bounce back physically, right?
Mhm.
And I'm not saying we should be away from work for a year to 2 years, but I believe every birthing parent and even adoptive parent should get at least 6 months. That is my dream. Because
Mhm.
you think about what happens in that first 6 months, right? The physical recovery, the mental shift, but also sleep, right? I
Yeah.
am not expecting a newborn to sleep through the night, nor should anyone. But how can we expect a parent to go back to the workforce when their baby is up every 2 to 3 hours, even if they're well fed? Because that's the norm early on, right? Early on in those first few weeks, it is very common 2 to 3 hours, maybe
Mhm.
even an hour. Yes, maybe by 6 weeks we can start to see stretches, but when we're demanding people to go back to a workplace, we're setting them up for anxiety, for depression, for poor work performance. So this capitalistic culture of sending people back and not giving leave, it's actually doing more harm than good because then it's going to force people. to leave the workforce or not procreate, because what do you
Yeah.
do? Like, what do you do?
Yeah.
Like, if you need money, like, but you can't do this both, like, you're going to say, well, I maybe don't want more children because I can't do this. I can't afford to have this experience again. And so it really is a backward way of thinking in this country.
Mhm.
I applaud Bobby for their efforts. I've been very vocal about the fact that I love that they do this advocacy, because it is so harmful for the parent. It's also not great for the child. I mean, the child needs their caregiver. I mean, and
Yeah.
now who's watching that caregiver, like, or who's watching that baby, and how is that caregiver feeling? And so, option. I want that option, because some parents will say, no, 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 I'm fine. I have a great nanny. I have a great grandma that can help. But many people don't have that community in America, right? They don't
Mhm.
have that village that's going to take on, like, hey, you're going to go back to work, mom. Go here. We're going to take care of it. And many women may not want to go back. I didn't. I
Yeah.
wanted to stay home and heal and connect with my baby and really get to know my baby. I didn't want to go into an office in the pandemic and see patients. That was the last thing
Mhm.
on my mind, even though I love my work, because you're not going to get that time back.
Right.
Those postpartum moments and the first few months of your child life, that's gone forever. Your job is always going to be there, but we need to do a better job of balancing this and offering paid leave for at least 6 months in this country is what I'm asking for if
Yes.
I would ever, reach the point of a politician, because it's so
Yeah.
important for so many
Yeah.
reasons.
Yeah. 6 months was my benchmark as well. That's when I
Yeah.
started to feel normal again. But yeah, I totally agree with everything you said.
Yeah, I went
Mhm.
back at 14 weeks for my son and 16 for my daughter. And
Mm.
14 weeks after a very traumatic delivery
Yeah,
was hard.
that's
I mean,
yeah.
and that is when I started to have anxiety and depression, because I was in that friction of, I don't want to go back to this stressful job, and I also want to be home with my son. And
Mhm.
I couldn't do it, and it really impacted me. And so we have to recognize that going back to work in itself, because it's a huge life change, can cause a lot of mental health issues for a person who's not ready to go back. Maybe they had trauma, or maybe they just want to spend more time with their baby, which is why we need the option for sure.
How long was your husband able to stay with you? Oh.
So he doesn't get any leave, which is awful. So,
Really?
yes. So it's hard to explain, but in the ER world, depending on where you practice, he's an independent contractor, which means he only gets paid if he works. He's not
Mm.
salaried by, like, with benefits and things like that. So there's a trade
Oh.
off there.
Yeah.
So if he doesn't work, he doesn't get paid. So we made, for our second child, we moved around finances, saved money, and said, you know what? I need you to take at least a month off because I need you here. And then he did, but we also had the complication. So it got 2 to 3 weeks of that month was taken up by me in the hospital
Mhm.
because I was
Wow.
back and forth from with
Yeah.
complications. With my daughter, or with my son, he had planned on going back after 2 weeks. We're like, well, we need money. Like, we have to pay
Mhm.
bills. And then he ended up having colleagues take on his shift. So neither of us got paid any salary for the 8 weeks postpartum, because
Wow.
we had to stay home, and where we live, we don't have paid leave. So yeah, and you think about that. I will admit that, yes, we're physicians. We were able to save money, but you think about the average parent who doesn't have
Yeah.
that privilege, right? And even for me, I didn't like that. I didn't like having to recover and have thousands and thousands of hospital bills without getting a salary. I mean, that's
Mhm.
not fun for anybody. But I also understand that the average person in America doesn't have that access. So they have to go back to work to pay for their new baby. And that's so twisted. like
Yeah.
like
Oh my
they can't even be
god.
with their baby. And so it's like really hard. And yeah, my husband didn't get any leave, and that was hard for us. I mean, and it was hard for me. I had so many breakdowns because I'm home with the baby, can't even sit up straight, having to care for the baby. For the second child, we ended up hiring help, again, privilege. We hired a
Mhm.
doula, but I have no qualms in admitting that, because I wish every parent would have access to help in those early
Mhm.
6 weeks. And other cultures have that, but in America, we're telling moms, "Hey, have this baby, but you're not going to get help postpartum. You're just going to have
Right.
to figure it out on your own."
Right.
And that's so harmful, because we're not meant to do it alone. We're meant to have other women help us. We're meant to have people cook food for us. I think about Indian
Literally,
culture. We're meant
yeah.
to have people come stay with the family when they have a child, to help the mother and the parents so that they can take care of their child. And that's lost in American culture, and thanks to capitalism. So it's really
Mhm.
sad.
Yeah, it is. I had no idea ER doctors were freelance essentially. Like that's
Some are not. So he
okay.
works at a practice that is like that. Some are salaried. Depends on
Mhm.
what state you're in, but Florida, where we are living right now, is like that. So
Wow.
it's not the best. It obviously we knew that going in, but even though you
Yeah.
know that going in, when it actually hits, you're like,
Yeah,
"Ooh,
it's
this isn't
different.
fun." Like
Yeah.
I don't like the fact that you have to move your shifts around so that we can get the salary that we're expected to get every month,
Right.
or take a no salary month and a half. That was a huge hit, and it's really hard and a true reality for so many.
Do you have any other help besides the doula that you hired, for example?
Yeah, and
Do you-
so, for the first, I look back and I'm like, wow, I can't believe I did it without help. Like
yeah.
in retrospect, because yeah, the doula changed my life, like postpartum with my daughter, because
Yeah.
second time was a harder recovery because I had already had 5 surgeries prior to that. So
Mm.
imagine like the abdominal healing. So I couldn't stand up straight. How could I take care of a baby? Both times my mom was there for 6 weeks, but then she had to go
Mhm.
back to where she lives.
Mhm.
And that was a blessing for my son. And then when the doula left, though, or sorry, when my mom and dad left after my daughter was born, that was really hard for me because I had the doula coming, but I didn't have any help during the day, and I had 2 children. And
Mm.
so that was a huge anxiety piece for me because now I'm having to manage 2 kids without my
Mhm.
husband's help, without my parents there. And yes, the doula was coming at night to help with my daughter, but it was really hard. So 7 weeks, and we all know 6 to 8 weeks with babies is very hard. I would say it's actually really much harder than the first 2 weeks because
Mm.
the first 2 weeks you're in honeymoon period,
Yeah.
you're learning that, but then it starts to settle in and you're like, oh crap, I gotta do this thing. And the
Yeah.
sleep deprivation starts to hit and you're like, oh man, this baby's still not sleeping through the night. I guess people were right. And
Mhm.
so it is a hard time and they can develop fussiness and colic and all of that. And I remember just crying one night at the corner of my bed when my husband came home at midnight and I couldn't settle my daughter down because I was so overwhelmed. And he just took her from me and he settled her down. And I just cried. And I
Mm.
said, I can't do this. And that's
Mhm.
me having the experience I do, knowing what I know. And I share that because I know how hard it is. Like we tend to sugarcoat and, put these filtered pictures of beautiful postpartum experiences. And yes, that can be the reality of many, but it also is really important to remember that even the most put together mom on social,
Mhm.
even the one who seems to have it all together, is probably up in the middle of the night crying because she's sleep deprived and
Mhm.
anxious and depressed. And those things are human feelings, especially postpartum, that I hope we can really normalize and share that range of human emotion after having kids.
I was gonna ask, as a pediatrician, did you feel like uber prepared to be a parent? But just hearing you, talk about actual real life experience, it's so much different when you're in it. Like it's like
Yeah.
nothing could really ever prepare you for that.
And
Um
my daughter, like with sleep, like my son was a very good independent sleeper, meaning you could
mm,
put him in the crib, he would fuss a little bit, but he would be fine. My daughter took a lot of work to get her into an independent sleep space. And so I would be like, whoa, like, and I know how to handle that from a pediatrician standpoint and all the education I give my community. But when you're in it and you're dealing with a baby who the moment you like lay them down starts to cry, you're like,
yeah.
well, she's gonna be stuck to me all the time. And maybe that's what a
Mhm.
family wants, but I really did want to get her into an independent sleep space and worked with her, got her there, and of course now she loves her crib and everything's great. But yeah, just a little example of like how child to child things can change and
Yeah.
how every baby is different. And so really learning to be flexible and understanding that what worked with one, what may not work with another, and that includes your friends telling you, "Hey, I did this for my kid. It'll work for your
Exactly.
child."
Yeah.
Maybe not.
No.
Worth a
Yeah.
shot, but remember, every baby's different.
Yeah. I wanted to ask, since you brought up sleeping, this is very selfish of me, but I'm dealing with that now. Because my experience is kind of backwards. She was an angel in the beginning and slept perfectly from 2 weeks to 5 months every night in her bassinet and crib. And now she started teething and is just turning up
Ooh,
like all the time. And it's hard getting her consistently to sleep independently. It's like I never know what's going to happen. It's like we're just rolling the dice every night, seeing what happens. And I know that's like a loaded question. Like you said, every baby's different. But is there anything you recommend or even if it's just a resource for me or anybody else to look into dealing with
Yeah.
that?
How old is your daughter at the
She's
time? Right?
8 months currently.
8 months. Okay, so you're dealing with a baby who's teething. My daughter's 11 months at the time of this recording. So 8 months, not only are you dealing with teething, you also are dealing with separation anxiety. Separation anxiety can start 8 months and beyond. So that baby who was used to being alone, for example, like in their own independent sleep space, is now like, wait, what? Where are you going? Like, you're
Yeah.
supposed to be here with me. And so very natural for them to protest is what I call it, right? Like protest what you know that they used to do. Now, the approach, I have a bunch of resources I have courses and YouTube videos and on my platform. But some basic advice would be like, first, you need to know what your guys' philosophy is in terms of approaching sleep. And I say that because for me, I was okay with graduated extinction, which means crying for little intervals, checking in, crying, checking in. So I say that because someone listening may be like, absolutely not. I'm not going to let my baby cry. But what I will say is that graduated extinction or the Ferber method is something I really, really, really love because you're giving them space for a little bit to see what they can do, which is amazing. And then if they're still crying, you're going to check in. You're not leaving them to cry for the whole night. They're not going to be crying for hours and hours, okay? So the first thing to think about also is that if they're actually teething and you feel the tooth coming through, you see that white little nub or that red gum, you may consider teething toys, but you may consider that they may need pain meds like acetaminophen or ibuprofen. And my daughter is a very sensitive teether, and all her regressions with sleep have had to do with teething. And so we would we'd go in there and comfort her. But if she would still cry and we knew that she was teething because she was drooling and we saw the gums, we would give her a dose of Motrin and then we would comfort her down. We wouldn't leave her there, but we'd calm her down, talk to her, lay her down, rub the belly or rub the chest, crib side, and just talk to your child and say, I know it hurts, or I know you want mommy. I love you. I will be right back. I'm going to give you some time and I'll be right back. And they understand. Like my daughter looks at me and gets it. Like she'll look at me and she'll cry sometimes. And I say, I love you. I'll leave the room. I'll look on the monitor, watch my baby, make sure that she's safe. She obviously is. Give her 5 minutes. I time it on my watch because 5 minutes can feel like 30 if a baby's crying.
Yeah.
And then if she's still crying, I go back in and I say, you're upset. I know, honey. I pat her back again. I love you, honey. I love you. The reason why I like this method again is that we're allowing that child to feel safe in their sleep space, but also checking in. So we're reaffirming that I know you have separation anxiety. Look, I came back. I didn't leave. I'm coming back. So it really does make sense from a developmental perspective. Some people are very anti, and I don't understand why, because there's data that shows that it actually is very safe and effective. And so that is just one strategy. And of course, if that's not your cup of tea, you can, some families will lay in the room or sit in the room until the baby falls asleep and then leave. It's called camping out. Some parents will hold the baby, get them down to where they're a little bit drowsy, set them down. Always cribside reassurance. I mean, I cannot stress the importance of like letting them know that you see that they recognize that this is a space that, wait, what? I'm in, but just saying you're fine. I'll be back. Leaving, coming back, leaving, coming back. And so that can really help. And the Ferber method is one of my favorite things, but I have a lot of different resources and strategies because I know, again, not every family is comfortable with that, or maybe every baby needs something different. But even though I have a clinger baby, which is my daughter, she could be attached to me at every moment if she'd want. And even though I have a baby who's more independent, Ferber did really work with both of them. And I say that because I have very different temperament babies. And although the crying was hard, I know that she's safe. She's in a safe space. I know she can do it. And if she can't, I'm going back in there and we're going to chat. We're going to talk. We're going to reassure her. And so that's like a kind of autonomy, but also intervening if needed, so that we don't just we're not abandoning our babies to just figure it out on their own. We're giving them some space to do it.
Yeah. Okay, cool. I'm going to look into that and try it out, see what happens because I'm not
Yeah.
opposed to it at all.
And the most important thing is come up with your plan that's consistent. So just say you start reading some resources. Whatever you do, you want to be consistent with the approach. So if you
Mhm.
do a Ferber, for example, be consistent with Ferber. If you do a more I'm going to stay in the room approach, didn't do that, right? And so you want to
Yeah.
have an approach that's consistent with all caregivers. So it's not like, well, sometimes we're going in, sometimes we're not, sometimes we're doing this, sometimes we're giving a bottle, sometimes we're giving a pacifier. You want to have like a very consistent approach so that it
Okay.
becomes the normal routine that they're like, okay, I can do this again.
Okay, noted. I also wanted to ask you, being a new mom or first time mom, I tend to look to the internet for a lot of advice. And, my pediatrician, she's not available 24/7.
Yes.
I have a subscription to, I think it's called Blueberry, I think, or
Oh,
something
yeah.
like that.
Mhm.
Yeah, yeah. But sometimes I'll still look up stuff. But I feel like for everything you can look up, you can find a counter argument to that. So, how would you advise people like surf through the noise and to find valid advice to take as a parent?
I think it's so important to when you hear content, you want to make sure that the person has credibility in that field of what they're
Mhm.
talking about and have experience too. So it's not just that they can read research, but also have they been able to apply it clinically, especially when it comes
Mm.
to parenting and all the things that you're probably searching. That being said, just because someone's credentialed in something doesn't mean that they're going to always give the best advice. So,
Yeah.
whenever you're listening to something, what I try to do, for example, is I always am very clear on if there is evidence for this or if it's clinical experience. What I mean by that is I have a lot of clinical experience. I see a lot of patients, but some of the stuff that I do is not based on evidence, it's based on practice, right? So,
Mm.
really getting into an idea of okay, what is this person saying? What is the language that they're using? If you're reading information that's very inflammatory and very fear-mongery and very polarizing, it probably is from coming from someone who is trying to sell something or someone
Mm.
who is not understanding other perspective. And I'm going to use the example of sleep because you already asked that question.
Mhm.
So I will never support a sleep account because there's tons of accounts online that shames sleep training or cry it out. Cry
Mm.
methods of sleep training, meaning Ferber method, because I know that there's data that shows efficacy and also safety. But I also will not support someone who sits there and shames parents for co sleeping or bed sharing. And what I mean by that
Mm.
is saying, if you do that, you're a horrible parent, your kid's going to die. Because both of those people can be guilty of, right? So I
Mhm.
take a more balanced approach. Of course, I want to teach independent sleep skills because I like it. I think it's really great for everybody. But I also know that a lot of the world co sleeps and bed shares. And I would love to provide resources on families to be able to get safety, advice. The AAP is very, do this and do that. But even on their website, they even say, if you're going to be co-sleeping, remember the risk. Here are the
Mhm.
reasons why it can be risky, but make sure you're not doing X, Y, and Z. So I say that because that is when I would get worried when people are saying, this is very harmful. Clickbait, clickbait, clickbait.
Yeah.
Or you're going to ruin your child if you do this. Ruin your child? Like, even when I approach things and talk about yelling, right? We know that yelling is not really something that is conducive to good child behavior. But I'm not going to do a clickbaity post that says your child is damaged and going to end up in trauma therapy if you yell, which I see all the time. There's so much
Mhm.
nuance. How much are you yelling? When are you yelling? Are you threatening? What is going on in the family? So watch out for clickbait. Watch out for very polarizing advice that says you must do it this way. It has to be this way. And listen to if you understand that how the person disseminates information and if it makes sense to you, right? I
Mhm.
hope that people would love my platform. That's what I'm striving to do, right? A whole platform where people can go to get this more balanced, non-judgmental approach, knowing what I know. I mean, some things we have to admit are harmful, some things are not, but really just saying, you know what? Here's the information. I need you to take this information and now make the best decision you want for your family, knowing
Mhm.
all of this information that I see clinically and from evidence, and that is what I hope more people can do and more accounts should do online as well, and blogs. There is just so much polarization in the sleep world, development world, and also in the feeding world, and it
Mhm.
doesn't serve anyone benefit and also can cause more stress because, like you said, you're reading conflicting advice. So
Right.
pick two people online, maybe three accounts you really like that are balanced, that are not clickbaity, that are not judgmental. And if you like the person, that's huge too. You shouldn't be getting advice from people that you're annoyed by, because then if you wouldn't talk to them in person, why are you getting information from them online is my
Yeah.
philosophy.
Going back to feeding, especially as an IBCLC, you did combo feed with both? Or
So
you
with our son, we ended up doing formula alone
Mhm.
because I couldn't even produce breast milk.
Right.
And with our
Mhm.
daughter, I went into it like, hey, I would love to nurse. And when I decided that nursing wasn't for me, I loved exclusively pumping. And so then we needed to do formula initially. And then I was able to get to a point where I was completely 100% exclusively pumping and got her to a point where that's all she needed. And then I loved pumping until I started having to travel a lot for work
Mhm.
and just for recreation and for fun. And I didn't want to bring my pump anymore. So around 8 months, I made the decision to start to wean. And by all the blessings in the world, I had so much of a freezer stash for breast milk. And I started to wean, and then we started using Bobby formula to help take her to that 1 year mark where we could start to do cow's milk. Because of course, when you're not pumping anymore, you're going to go through that freezer stash pretty fast. And so
Yeah.
we started to do a mix of like a quarter of formula, 3/4 of breast milk. And, I like Bobby. We didn't use Bobby for our son because at that point it wasn't as well known when he was
Mhm.
born in 2019, for me at least. And then I like Bobby for so many reasons, but one of the biggest things is the company as a whole, regardless of just the fact that they are a formula company, is on a mission, like we just discussed, to really change the narrative for parents, right? Like
Mhm.
paid leave, advocacy, things about, body image, so much that I think and I align with is why I love the company as a pediatrician, but also just as a human being.
Mhm.
And their formula, is obviously made in the United States, follows a lot of the European kind of guidelines for regulations and stuff, but really nice. My daughter tolerated it. And so it was just an easy transition. And we're going to now be transitioning her to cow's milk. And so she got maybe like a month of Bobby formula mixed in with her breast milk, and then we'll be going to cow's milk. And so really grateful for a company that has this in America, and also just doing all the advocacy work that they continue to do while still
Mhm.
being very on top of their ingredients, and also regulations and making sure that the formula is as safe as possible. And, the processing of it is also the best it can be, which I think every parent, if they're going to be giving their child anything that's formulated, would want that. So I like that about the company. And I'm always happy to, chat with y'all on your show and, work with you all on these advocacy campaigns because you're doing great work. So thank you.
Thank you. And obviously, it's a Bobby podcast, but we started using Bobby early on too, and it worked great for us. And we still continue to use it to this day. So, yeah, we love it too.
Yeah.
Well, thank you so much for talking with me today, Dr. Mona. I sincerely appreciate your time and all the advice that you gave me and all of our listeners. Please tell us wherever we can find you.
It was an absolute pleasure. I love chatting with you. Again, this was such a joy. And people can stay connected with me on my website. So pedsdoctalk.com, PEDSDOCTALK. And that's also my Instagram, my TikTok. And I have a YouTube channel and my own podcast, the Peds Doc Talk podcast. But the website and the Instagram is where you can go to get into the community, get into comments, send me a DM. And also, my website has searchable information. So, all the content I've ever produced on my platforms, you can search by keyword on my website. So, if you're searching for sleep or regressions or all the things that we discussed, I have a wealth of
Mhm.
information there.
Awesome. Thank you so much again. And that was another episode of Milk Junk.